Hello, I am here joined with Genevieve Marnon from Right to Life of Michigan. It's great to have you on this podcast today, Genevieve. I've known you ever since I've been in the legislature. You've been the legislative director for Right to Life of Michigan for many years now, and there's not an issue that concerns life that you are not an expert in. So, really appreciate you joining today to talk about an assisted suicide package that's been proposed by the Michigan Senate Democrats.
Well, I appreciate you having me on, Senator. This is a topic that most people don't think about, and so it's really good to flush it out.
Well, maybe to start with, we will, I guess first I'll talk about what our laws are in Michigan. Right now, it's currently illegal to have assisted suicide in the state of Michigan. For those of us that were around in the 1990s, we were quite aware of Dr. Jack Kevorkian and everything that was going on in the late 90s. This was a huge issue. There was actually a ballot initiative that I think it was 1998, and it was going to legalize assisted suicide in Michigan. It had just become legal in Oregon the year before, and
hmm
it failed. It failed by over 70% voted no.
Yeah, yeah. Dr. Jack Kevorkian was desperately trying to thrust assisted suicide into the mainstream, and people rejected it, rightfully so, because it's a very dangerous practice. But yes, we do have the legacy here in Michigan of having Jack Kevorkian, and so it's actually shocking that they're bringing these bills up, giving our legacy.
Yeah, and especially when you look at the bills, you can really see there's some concerning aspects of it. There's a four-bill package, Senate Bills 678 through 681. Three of the bills are just kind of what we would call in the business trailer bills. One requires insurance coverage. One deals with the Code of Criminal Procedure. It makes it a Class B felony to coerce somebody to do it or to forge documents. 680 deals with the Public Health Code, basically prohibiting DHHS from doing license investigations if they're in compliance with this act. Also has some reporting stuff with it as well. But the main bill is Senate Bill 681. And the part of it that's most important is Section 3. I'm just going to read it because it's pretty short and simple. It says a patient who is capable has been determined by an attending physician and a consulting physician to be suffering from a terminal disease and has voluntarily expressed the wish to die may make a written request for medication for the purpose of ending the patient's life in a humane and dignified manner in accordance with this act. So I think another key part in there I'm going to read is the terminal disease because that's a defined term. It means an incurable and irreversible disease or progressive pathological condition that has been medically confirmed and will, within reasonable medical judgment, produce death within 6 months. Um, that's not all of the bill, but I'd say that is by and large what the bill does. So, um, Johnny, maybe I'm thinking back to the days of Dr. Jack Kevorkian when you'd see pictures of him sitting at the bedside of, a patient where he would provide a lethal injection. So, is that what's going to go on here, or how would this actually practically play out in the state of Michigan?
So a lethal injection is technically defined as euthanasia, which is not it is prohibited in the United States as of now. There are several other countries in the world that do allow active euthanasia, where a doctor is employed to provide a lethal injection, very much like we do with capital punishment and criminals who've been convicted to, die through capital punishment. In the United States, it's suicide. You kill yourself by ingesting the medication, the pills that are provided to you. So the difference between euthanasia is euthanasia, a doctor injects you and or kills you in some other fashion. And with assisted suicide, you take the pills yourself. And that's what these bills would allow, is a cocktail of powerful drugs that you take. And by the way, this whole concept of dying in a dignified manner, there's no way that they can guarantee that you will die in a dignified manner. And in fact, we have cases where people take these pills and they vomit. We have cases where they take these pills and it burns their throat. We have cases where they take these pills and they don't die. So there's no guarantee, because these drugs are not FDA approved for this. There's no FDA approved drug cocktail to commit suicide with. They're just making this up as they go. So people need to be aware of that.
Yeah, I also think I think one of the most shocking elements of the bill is there's a provision in there that allows local governments to be reimbursed if they have to deal with this. Presumably, if someone was to do this in public and the local government had to take care of the remains, which would be shocking for anybody that's in the public place where somebody just died. But the idea that this must have happened somewhere, or this has been an issue somewhere where they built that safeguard, if you will, into the bill. I thought it was very bizarre.
Well, call it a safeguard. They claim that all these suicide bills, the assisted suicide bills, have built-in safeguards. You can't coerce someone, governments will be reimbursed just to get your life insurance, all these kinds of things. But the reality is, these safeguards every single time become, quote, barriers later on. And so they try and convince the public that nothing bad will ever happen, no one will be coerced, there will never be any abuses, and surely every single time, and you can point to other states, they liberalize them later on. For example, these bills, when they were introduced a few years ago, had a residency requirement. They've taken that residency requirement out, claiming that it's now a barrier to access. Well, now what that does is it opens it up to assisted suicide tourism. People could be coming to Michigan to commit suicide here in our state, and then we will deal with the remains.
Well, another quote unquote safeguard they will claim is that it has to be a terminal illness. Um, Maybe could you talk about how that, what they'll call a safeguard, becomes liberalized, if you will, maybe what we've seen in other countries or in other states, different ways they've tried to weaken this and to allow other types of terminally ill patients to be eligible.
So the term terminal illness is a relative term. First and foremost, MD does not actually stand for minor deity. They don't have a crystal ball, and well, I'm not criticizing doctors, and they do their very best to predict when someone will die. I personally know someone who was given a terminal illness diagnosis, eligible for hospice, 6 months to live. He's still going 6 years later. I know another one who was told that he's going to die, get down here, your dad's going to die. And that was 18 years ago. So
Mm.
that's one. But the second thing is terminal illness. A person can become terminally ill if they decide to stop taking their medication. And the perfect example of is a diabetic, an insulin dependent diabetic. Well, they can live many, many years, happy lives, taking their insulin. But the minute they decide, I'm not going to take my insulin, a doctor can predict that you'll be dead in 6 months. Same goes for an anorexic patient. You stop eating, yep, you'll be dead in 6 months. But that's not a terminal illness as anybody understands it. So there's a lot of play in the way that they define terminal illness. And I think people need to be aware of that.
Yeah, and I think, for anybody who thinks, well, that just, it's exaggerated. Nobody could really die from this bill, from anorexia. Well, if you look at Oregon's report, every year they put out an annual report, and it's pretty detailed as to what the illness was. In one of the footnotes, they actually listed anorexia as one of the conditions that made that person eligible for assisted suicide that year. So it's not an exaggeration. It can happen. Um,
It does happen.
and it does happen. What are the advocates saying? So, I've read different articles with those that have introduced the bill. You know, what rhetoric are they using to try to convince people that this is a good bill?
The biggest argument is radical autonomy. That's the biggest the idea that you are in control of your entire destiny. You're in control of life, death, when you die on your terms. And that resonates with a lot of people, that somehow or another they can be in control of their own death. Well, I'm here to tell you that you never really know. You or I could die today, right?
Mm.
So while we like to think that we're in control of life and death, we're not. But that's what these bills give the illusion to, this radical autonomy and this idea of freedom. But they couch it really in this idea of alleviating irreparable suffering. You don't want people to suffer. But if we look at the data from places like Oregon, where it's been legal for years, suffering and pain is like way down on the list.
Yeah.
The main reason that people choose assisted suicide is loss of autonomy and not wanting to be a burden on other people, not being able to engage in things that they considered enjoyable in life. And that is really more of a psychological, social, and emotional issue than it is pain and suffering.
Yeah, I would say it's more of a loss of hope. More generally speaking, I think that's the unifying principle between kind of all of the main drivers of which would lead somebody to want to do this. But
Absolutely. It's the same drivers that
mm,
cause people to want to commit suicide without the assistance of a medical
yes,
professional.
yeah, and here's the irony though. So they will say isn't it brings complete autonomy to somebody. Well, only like first off, you're doing this alone. You're not doing this in a controlled setting, and you could be doing it at your house. You could do it anywhere, and I saw like in some states that have legalized this, like 30% of people or so don't actually take the drugs after they get them. And there's not actually anybody to monitor how it's being administered. So it's actually very possible it could be coerced and it could be taking away their, autonomous decision making because there's no oversight of this once it actually happens. So
I
that
think
is
people
it.
have this illusion that it's this sterile environment, that there's a professional medical provider right there, and that's just not the way it works. You
Hmm.
request the drugs, you get the drugs, you bring them home, you put them in your medicine cabinet to be used whenever you decide you want to use them. And the reality is, sometimes people die before they ever take the pills. What happens to all those drugs? I mean, we have an opioid epidemic going on right now in our country, and yet these powerful drugs include opiates, and yet there's no check and balance. There's no medical professional that's required. You don't even have to tell anybody that you've requested the drugs and that you're planning to commit suicide via lethal drugs, so somebody could walk in and find you dead, not really knowing that you had taken all these lethal drugs, right?
Yeah.
So, and you're right. There's no oversight with regard to what happens to these pills if you change your mind, and then you just die of natural causes. And that right there should be very concerning to people.
So maybe you could talk about some of the practical problems of there's arguments about, well, you're going to incentivize insurance companies or health providers to do this as a cost savings. I've heard that these drugs will cost about $300. Compare that to hospice care or other hospital care. I mean, it's obviously a heck of a lot cheaper. So, what are some of the practical concerns with that?
Well, that is a practical concern right off the bat. I mean, there's a woman in California right after assisted suicide was legalized, and she has cancer, and she wanted to get this. It's very expensive chemotherapy drug, and her insurance company denied payment for the chemotherapy that would have kept her alive. And in the same letter said, but we'll pay for your assisted suicide drugs with a dollar
Hmm.
twenty copay. A
Yeah,
dollar twenty copay versus $10,000 for your chemotherapy. The government of Canada actually did a calculation to show how much money their national health care plan could save by legalizing assisted suicide. And I could go on and on about how crazy Canada's gone. I mean, they now have active euthanasia, minors, advanced directives, et cetera, et cetera. It's the killing fields.
yeah, and they
Um,
actually expanded to mental illness. Thank God, I don't think it has taken effect, at least into law, but they've at least passed allowing mental illness to be a qualifying condition.
Absolutely. In
Yeah.
fact, they did a poll, and a large percentage of Canadians believe that assisted suicide drugs should be made available for poverty and homelessness. That is not the way governments should treat poor or homeless people.
Yeah,
Here, we aren't going to give you a home. We're not going to feed you. We're not going to take care of you, but we'll give you lethal drugs.
unbelievable.
So, yeah, anybody who thinks that insurance companies are not going to favor a cost saving measure like getting people to voluntarily commit suicide using lethal drugs isn't really paying attention. Yes, we don't have national health care like they do in Canada, but let's be honest, insurance problems are a problem and healthcare is very expensive.
So, I remember back in the 90s, one of the biggest arguments against this is the slippery slope kept being brought up. Um, maybe you could, we've talked about some of them, but what is that slippery slope? What are the next steps that we've seen after, something like this kind of model legislation that they've copied becomes put into law? What do we see that advocates of assisted suicide will try to do next? What's the next safeguard, quote unquote, they turn into a barrier that they try to tear down?
Well, so advocates of this will point to the fact that Oregon's had assisted suicide legal for years and years and years, and we've never seen any abuses. Well, that's because you're not looking, number one. And number two, we have seen that slippery slope. Oregon used to have a residency requirement. That's been lifted. Now we have assisted suicide tourism over there. They used to have to wait and have two requests. They had to have two doctors sign off. They had to have a mental health screening. None of that's required now. So even though our drugs say that our bills say that a doctor can refer you, they may refer you for a mental health screening. They're not required to. They're not required to. So it sounds like all these safeguards are in place, when in reality, if you really drill down into it, there is no requirement for a psychiatric evaluation. There's no accountability for these unused drugs. Patients who aren't actually dying could be diagnosed as lethal or as terminal and receive these. No in-person consultation with telemedicine, right? So all of these kinds of things make this ripe for coercion and abuse.
I'm glad you brought up that last one because I've read the bills a couple times and I, f- I feel like it's silent, these bills on telemedicine. I don't see it being prohibited. So I guess you've read the bills as well. Do you think telemedicine could be permitted? I know in this, the way it works is you'd have to basically give two oral requests to have assisted suicide, then you have to give a written request. But I haven't seen anything that requires anything to be done in person. Is it silent on that? Does it prohibit it? Does it allow it? What are your thoughts?
It allows, yeah, because it's silent, and we do have telemedicine that's very, very readily available and used in the state of Michigan. It's very legal. All this says is you have to have two oral, which could be on the phone, could be a Zoom meeting, maybe not a Zoom meeting, maybe it's just over the phone. And then one written. I could send you an email. I can write a letter.
Mm,
In other words, there is no requirement in the bill that a patient actually be physically examined. So a tired caregiver could be pushing you. Family members could be pushing you, and you would not necessarily know that that's what's going on. So this
yeah,
right to die can very quickly become a duty to die.
yeah. I mean that if telemedicine is allowed, the problem of coercion becomes even greater. I mean, that opens up all sorts of different ways that coercion can happen. Um, Well, maybe
Mhm.
for the last thought here, we've talked a lot about practical problems if this were to be implemented and things people should think about. What are some of the ethical concerns that Right to Life has put out there as to why assisted suicide is bad policy for the state of Michigan?
Well, first and foremost, assisted suicide is discriminative. It's discriminatory. In other words, we have we have suicide prevention programs. In fact, September is Suicide Awareness and Prevention Month. We just did a resolution in the Senate this week. Um, and yet all those suicide prevention measures are denied for people who are terminally ill. So if you're not terminally ill, we try and save you and give you interventions and mental health care, et cetera, et cetera. But if you're terminally ill, then you're denied all of those interventions. That's number one. Number two is, let's be honest, these bills are terribly concerning for people who are disabled, who are elderly, who are vulnerable. Um, disabled the disabled community is absolutely targeted with regard to assisted suicide because so many of them require interventions that without these interventions they would automatically be considered terminal, and they are pushed. And we have heard many stories of disabled people who are basically told by their doctors, well, why would you want to live? Why would you want to live? Why don't you have you considered assisted suicide? I mean, it's a very big concern for the disabled population, and that is a very ethical concern that we are exploring for sure.
Yeah, and just the hypocrisy of the phrase that they use, "death with dignity." because it's an alliteration, they think it's somehow clever and meaningful, but it's so hypocritical. The idea of dignity is one where it's a first principle that every human life has value, is dignified, and what this bill is doing by allowing assisted suicide is saying your life has value no more. And it's just, to me, that's the crux of the ethical of concern and why I oppose these bills because, every life does have value, every life does have meaning, and it deserves true dignity, not just an alliteration
Well,
and some hypocritical statement
one
put out
other
by the. Yeah,
a huge thing, and people forget this too, and for me, this is a very important thing. I respect our medical community. My daughter's a nurse. I have friends who are doctors. Assisted suicide turns our healers into killers. And I hate
mm,
to say it that way, but it's true. When your doctor is just as willing to give you a lethal drug prescription, are you really going to want to trust them to also give you the very best they can to keep you alive and keep you going and keep you healed? So that's a big concern, and so much so that the American Medical Association came out in opposition to assisted suicide
yeah,
just last year, and the Michigan State Medical Society came out just this May in opposition to assisted suicide. They realize that this puts their medical providers at a crossroads, and it's a problem.
yeah. Well, Genevieve, hopefully these bills do not come up for a hearing or being passed out of the chambers this year. Really appreciate your time and your expertise and your willingness to come and talk about this issue. And so I thank you for being here, and I'll see you around Lansing. So thank you and
Sounds
God
good.
bless.
Thank you so much. Take care.